That's where the serial entrepreneur helps, to know that you've been there before. Things got sticky and messy, and then you figured it out and you cycled through it. So that helps to know that you don't have to ride the waves. You stick right in the middle. You let the waves kind of lap over you. You don't go too high. You don't go too low.
Right.
You don't get too excited. You just try to stay even, because it's that roller coaster that'll kill you.
Hello, and welcome to Season 3 of The Founder Mindset, brought to you by ATB. I'm your host, Leah Sarich, and I'm delighted to be back for another season of talking to founders about what it's really like to build a company from that first big idea. If you've listened to previous episodes, you know I was a journalist for over 20 years, so I'm more curious about why anyone would ever want to become an entrepreneur. Not so much about the business model, product market fit, and so on. I want to understand why entrepreneurs keep going, why they think they're the ones to solve a massive problem, why they want to make a real impact in the world. And if you're here, I bet you want to know why too. Let's find out. Joining me today in studio is Sabina Bruehlmann, co-founder and CEO of Nimble Science, a precision medicine company revolutionizing the understanding of the gastrointestinal tract thanks to their SIMBA capsule, a medical device that collects data from the GI tract, including unparalleled access to the small intestine. Sabina, thank you so much for being here.
Thank you.
I'm so excited to have this chat with you.
Me too. I was excited to hear that company intro. I thought, that's cool.
Did you like that?
Yeah.
I wrote that myself. I'm so glad. I'm so glad you liked it. At the beginning of this conversation, we always take the little time capsule back in time and we go way back. It's like, how did you even get into entrepreneurship? I know a little bit. I know you're a biomechanical engineer by trade and you're a serial entrepreneur. You've done this 3 times. But I want to know, how did you first get into entrepreneurship? Do I have this right, that it had something to do with a critical hallway collision during your PhD?
It did, but the truth is I'm really stubborn and I don't like things to not make sense. It really. So when there's like a problem, then you just start solving it because it has to be done. And then you find yourself alone and then you call yourself an entrepreneur.
I love that.
Because no one's bothering to do it with you. No. Yeah. So that's the mindset. I was in my PhD just finishing, and I was really punchy, which is kind of a mood that I'm in right now. So just beware.
I'm into it.
I had won this award, which was kind of cool. It was this like International Spine Research Award.
Cool.
And I'd gotten the email and I thought, oh my God, we won. And I went out into the hall to find my supervisors who had obviously co-won with me to celebrate. And I ran into this guy, like I collided with him. Ran into him because I was not paying attention. And so I apologized and asked him what he was, and he was looking for the bathroom. And I said, I don't know why, but I said, you're not really looking for the bathroom. What are you really here for?
That's ballsy.
I know. I was just sort of in that mood. And then he said, well, then he explained what he was doing, which was to find out the truth about this technology. He was associated with a venture capitalist in Palo Alto, and he wanted to engage with different researchers to figure it out. And I was like, it doesn't really work that way. Like, they just hire grad students to do that work. Like, they don't have time to, they have the expertise, but they don't actually do the work. And so I said, you should really just have a company do it that engages them. And he said, well, why don't you come to dinner at night and we'll figure that out? And I was like, okay. And so we started a company.
Wow.
To do that. So then I hired all these grad students and I had all these researchers on contract that I got their expertise and they designed studies and the grad students did it. And I just sort of brokered this. And then we figured out that the technology was terrible and it shouldn't have a life. And so they paid me to shelve it.
Right. And that happens.
Yeah. That was a good lesson. That was a good way to start, right?
Yeah. It's a good lesson.
Not everything deserves to go forward.
Yeah. Wow. Okay. So that's the first one. But I do actually just want to take a moment to reflect on the fact that you did just pitch this guy in the hallway and was just like, well, I can figure that out for you. You go to dinner that night and then ta-da, it's done.
So I didn't really think about it. I was just like, well, this obviously you need to know this information. So obviously we need to do this.
So it was that obvious to you?
Yeah. Well, And so I followed my gut, which is what most entrepreneurs do, I think. Anyone that does this as a calculated is ridiculous because there's no calculation that says you should do this.
That's right.
So everybody's following their gut. So I just followed my gut, which is funny that I'm now following everyone's
health. Yes, I love it. I love that. Okay.
It's also tidy.
Yes, it is. So that's the first one. And then the second one was Zephyr Sleep Technologies. Is that right?
Well, first, when I was doing that company,
Yes.
they kept talking about IP.
Right.
And I thought they meant internet protocol.
What did they really mean,
Now,
Sabina?
to be fair, it was the early 2000s and internet protocols were a big thing.
Yes,
like
that's what
IP
everybody was
addresses were a
talking
big
about.
thing. So
Yes.
they were more than what they are today. But anyway, I realized I had to actually learn something if I was going to do this. So I went to the university and worked at the University Tech Transfer.
Right.
Back when it was called University Technologies International, or UTI.
Okay.
Which is
very funny also.
Which is very funny.
Yes.
And
all the women know
all
this.
the women and all the medical faculty know how funny the UTI. Anyway, so I learned some things there, and then I spun out with a company that was spun out of the university. So I just sort of hopped onto one of my portfolio companies.
Okay.
Yeah.
Okay, that's exciting.
Mm-hmm.
And to be clear, IP, intellectual property. Yeah.
IP is intellectual property.
Yeah, just to be clear. That's very fun. So how did you make that leap into just jumping aboard a company that you wanted to be a part of?
I really loved the founder, the now late Dr. Rummers. He passed away just a few weeks ago, which is tragic. Yeah. But I thought he was brilliant and wanted to work with him. And again, it was a problem that needed to be solved. And so I threw myself into that as sort of a junior co-founder, figured out, learned a lot, was able to work with a lot of people that knew different things and gained. So that's where I really cut my teeth and was able to sort of watch from the sidelines as to how this all goes down. Yeah. And then took that experience and founded Nimble with my co-founder.
That's so exciting. Okay, so let's talk a little bit about Nimble itself. First of all, what is Nimble?
Well, what was Nimble or what is Nimble?
Well, why don't we do both?
Yeah.
So how did it start and then where is it today?
So full props to my co-founder who went to his basement to figure this out. So he was the one that heard it from the skies that this technology was needed, that we needed better access to the gastrointestinal tract, and he figured out the capsule that would do it. And that's Dr. Joseph Wong, who's my co-founder in Nimble. And he brought me this capsule and he said, look, here it is. And I heard you were looking for a new company. And I thought, oh my God, this thing is so simple. Like it's a piece of plastic and it does this awesome thing. So I thought I could just do this with my eyes closed. The Zephyr technology was so complex, had so many complexities to it, AI and data and biochem and all this other thing. And I thought, oh my God, a piece of plastic, I love it. I'll just do this for a quick hot second and get this wrapped up and parked and then we'll just move on, right?
Right.
And then, as Joseph and I started, we started talking to customers and then we realized the value of the data and the interest of the data and the role that Nimble had to play to not only deliver access, but to deliver the information context in which, because nobody knew what nobody really knows what the small intestine looks like on a day-to-day. And it's a sort of the black box of the human body.
Right.
It's the control center and it's the black box.
Oh, wow.
Which is fascinating.
Very, very important.
Yeah. So then we had to create a data company so that we could understand what was in the small intestine and how to relate those to different applications. So now Nimble is a data platform that works with B2B companies that are developing consumer products and drugs and different types of solutions for GI health. We give them access and give them better data to develop those products. And then we also take those data and insights with them and develop diagnostic tools to translate to clinicians. So clinicians can have a better view of the small intestine and then better products to serve it. Wow. So it's kind of like a full loop, but so now we're more of a data platform than a...
Okay.
Yeah.
Amazing.
Not simple.
No, and not simply the medical device. It's much bigger than that.
It's much bigger than that.
Yeah, that's exciting. Okay. So then if we're talking today, and let's keep in mind that this content is evergreen. So how many employees do you have right about now?
23, maybe 25.
Yeah. And then you launched when?
What has launched me?
I mean, that's a good question, isn't it? That we all really need to answer.
Joseph started in 2018.
Okay.
We joined up in 2019.
Right.
2023, we were ready to really offer commercial products in partnership with companies around the world.
Yeah.
And then the data platform launched this year. So,
so exciting.
Stages of launch.
Got it. And do you want to talk about how much money you've raised?
Well, we've I don't know. No, because it's like 5
Yeah.
something like that.
Yeah.
We're in the middle of a raise. So we're always, this is evergreen because you're always in the middle
You're
of a
always
raise,
raising, right?
Yeah. So we are in the middle of a raise right now. Yeah, we have a phenomenal group of investors that really span the world and all of the different fields that we work in. So food and nutrition, pharma, data, devices, everywhere from New Zealand to France to Japan to the US. Wow. And so it really is a global company and a very much a global cap table, which is really exciting.
That's exciting.
Mm-hmm.
That's very exciting.
We could always use more from Canada, though. So if you're listening,
okay,
evergreen.
Here we go, Canadian folks. Pay attention. Here it is. Do I have this right that you're now integrated? The SIMBA capsule, anyway, is now integrated into over 19 global clinical studies. Is that right?
Yeah, there's 26 partnership agreements. About 6 of them are maybe benchtop studies and 20 clinical studies. Yeah.
That's incredible.
It is. And it's name a disease, like everything from, I just got off the phone this morning with a researcher in Austria who's done liver cirrhosis.
Oh, wow.
And she's just waiting for the data to come back now. Partnered with Dr. Valerie Taylor here with an OCD project.
Did I read something
fatigue,
about chronic fatigue?
Obviously, Parkinson's, multiple sclerosis, Alzheimer's, everything.
That's outrageous. That is incredible when you start thinking about the impact of these studies. And we'll get to that in a minute. But what I do want to dig into just a little bit is, we're sitting here kind of saying how amazing this is, and you've got these incredible global partnerships. But as we know with every entrepreneur, there's always crazy moments when you're building the company, when you're like, I have no idea if this is going to work or not. And we, maybe with the first one, you had to shelve that. It just didn't work. But in this case, can you think of a story that really sort of outlines that high stakes moment for you, like do or die moment?
No, it's every day. So this technology will solve problems, and it's our job to figure out where the problems are ready to be solved. And it won't be all of them. And so there's technical challenges or technical things to be aware of all the time. And that's so every day I worry about the technical risk every day. Because that's my job, which is, okay, I thought this was going to be about me and my mindset. We're getting there.
Too.
Okay.
Yeah.
I'm going to sneak in right now. Because you have to be like a cheerleader and have ultimate belief, which I do on a global sense. But on every problem you think, is this going to give us, because nobody needs more noise. Like the medical community, especially in GI health. Right. We don't need more storytelling that isn't data driven.
Right.
So the technical challenge, just this morning, you asked me the question there offline there. We were talking about what was on my mind and repeatability, right? We're really diving into the weeds of what signal is repeatable and where and how much and what's the clinical significance of that and what can we say. And so it's not like we made a widget and we tested the widget and then we're like, oh, great. How many people want this widget? Yeah. It's like, what problems can this data solve? And so every day there's a technical no-go.
So here's where we get into the mindset. So how do you, as a human being, deal with that kind of stress of trying to figure out, does this thing, is this useful? Is this helpful? Is this working? Every single day, you're saying.
Yeah. I'm stubborn.
Yeah. You mentioned that right out of the gate.
Huge. Yeah. Yeah. It's really, my PhD supervisor left me with many, many words of wisdom, but one of the ones he was like, wow, you're super stubborn. and then he was more gracious in saying tenacious. And it's like, yes, I just know that this is valuable information. Yeah. Because it's not just what's happening in our microbial environment in the small intestine, which is linked to all of these different, gut pathway type of things. It's actually a way of measuring what's happening in real time. So we can look at you ate this happened. So we can start to understand the body's reaction to certain types of impacts and stuff. So there's answers in there. And so you just you have to do 2 things. 1, you have to be stubborn. 3 things. 2, you have to have a team that can solve these problems with you. The team is huge, especially because of the multidisciplinary nature. And then you have to create a business model that allows for many of these things to be done together. So we've created a business model where these 19 studies and I think 14 different conditions. So we've got a systematic way of the needle in the haystack to look for what is where the answers are, and then combining that stuff to form bigger solutions. So, wow, it's a business model and a stubbornness.
And the stubbornness. I love it. So stubbornness, but I actually liked how your supervisor said, but it's also the tenacity.
Yeah, it's
right.
Word.
It's a nicer
word.
It's a kinder word. But don't you think that's absolutely essential?
Yes.
As an entrepreneur.
Have you ever met an entrepreneur that's anything?
No, anything but absolutely. No. You start to do this enough, you can see some pattern recognition going on. And tenacity and stubbornness, I guess tenacity. And resilience, I would suggest, also comes up a lot. That ability to keep going and be resilient and move it forward.
Yeah. And you don't want to go, everything, like my first story, not everything has a life and needs to be there. So there has to be a tenacious, but tenacity includes, knowing when you're solving a problem and when you're not, right? Whereas stubbornness is just kind of like going for it. That's where the serial entrepreneur helps, to know that you've been there before. Things got sticky and messy, and then and then you figured it out and you cycled through it. So that helps.
Yes.
To know that you don't have to ride the waves. You stick right in the middle. You let the waves kind of lap over you. You don't go too high. You don't go too low.
Right.
You don't get too excited.
Right.
You just try to stay even, because it's that roller coaster that'll kill you.
Right, right. So how do you deal with that roller coaster? Because that also comes up in these conversations every single time, that the roller coaster, huge highs, huge lows.
Yeah, I think. Well, some people are naturally like that, not me.
No.
So you just have
you're
to
looking
learn.
for an even keel.
Yeah. You just know that that's the way. That time will solve it. A good sleep will solve half of it.
Yeah.
Time will solve the rest of it. You got to keep moving forward. So you might be, I keep telling the team, like, we're building roads, even though we're still figuring out the car, but the car will drive on these roads. And so we understand what the roads are going to look like. And so you don't have to wait. So you're kind of building the infrastructure around you to scale as you're scaling the technical solution, right?
Yeah, that makes sense. I think those analogies are helpful, because I don't think people totally get what it is to be an entrepreneur until they're in it.
Yeah.
There's a lot of naivety at play.
There's a lot of naivete, yeah, for sure. And there's a lot of versions of what entrepreneurship means, right? Like, I think it's different for every kind of journey. I think
for sure,
for a very heavy technical, like Nimble is a very, we're doing something very technically difficult.
Right.
Versus commercially difficult, or, well, we've got that too.
Well, you've got that too. Yes.
Well, that's not, yeah. But then we also have some commercial pros, right? It's very cool. It's very easy to get meetings. People love to talk about it. It's easy to understand. Oh, I don't have this now. I want this.
Yeah.
So,
and it's solving some really cool problems. Yeah. We can talk a little bit more about impact in a minute, but I'm also really curious about how being an entrepreneur affects your relationships, your family, your friends, that kind of stuff. What does it look like for you?
Yeah, you end up being surrounded by people that get you, and but hopefully everybody is like that. I think it definitely puts relationships to the test. I'm a married woman of over 50. I'm in that sandwich: parents, kids, very understanding husband, and all of that is a reality of what. I'm thankful that I'm doing it at this stage of my life, because I have the wisdom of what I've learned, and I, learned that even keel piece. So it definitely tests relationships, less with your family, because they kind of, you can help them understand, you can kind of bring them, they're not surprised. But friendships are more difficult to understand the sort of mental stress that you're under. Versus, the mental stress that, everybody's under some sort of mental stress, but it's just a different type, right?
Yeah.
So it's difficult. It's nice to be friends with other founders. That helps for sure. Yeah, the community that we have is really helpful.
Yeah, no kidding. Let's talk just a little bit about that mental stress. Like, how do you cope with your mental stress?
Why do we think that we're coping? Where is this?
And maybe we're not, right? And maybe that's not
where is this
all.
Underlying goal?
Sometimes it's things that people try to achieve, right? They're still striving for the wellness.
It's continuous improvement. It's like quality management systems. It's a difficult one. Sometimes I'm coping and sometimes I'm not.
Yeah, fair enough.
And the people around you will tell you, how you're relating to the team and things like that, are telling you and then you need to adjust. So it's mostly just giving yourself time. And I know I'm supposed to say that you're supposed to exercise. And that would be great.
That would be great. Would be being the operative part of that phrase.
If I were coping, I would be exercising, but that piece has not been achieved very well yet. I don't know if you cope. You just sort of let it become part of yourself and realize, actually, you know what? Okay, I have a strategy.
Okay, let's hear it.
I learned this at Zephyr from a very a colleague that I valued a lot. And he came in from the outside world, meaning he hadn't always been in this kind of crazy environment.
Got it.
And we were in a room and doing all the things and he was like, oh my God, just look behind you. Nobody's trying to eat you. Like there are no tigers chasing you.
Oh.
And the physical act of actually turning your head and looking behind you and telling your brain that you're not going to get eaten actually brings the stress level down. So I do that all the time. I tell my team, stop, turn your head. If you see a tiger eating you, proceed. Otherwise, calm down. and your stress will adjust.
I love that.
Right. Yeah, do it. You have to turn around. No tiger. You're fine. Your body really is tuned to like, I'm going to be eaten. And you're like,
yes,
I'm actually not going to be eaten.
Right.
Something's
not
going to be
today.
late.
Yeah.
Or,
yeah.
Something's not going to be exactly the way I want it or whatever.
Right. And that's okay.
Yeah. You're not getting eaten. So that is a major coping mechanism.
That sounds very useful.
It is.
Yes.
Yeah. It has served me well.
And I would imagine too, and you sort of alluded to this, but as we get into our 50s, like there's a bit of wisdom and there's a bit of like, I've kind of been through this before. I know what this can look like and I'm going to survive. Like it's going to be okay. It's going to be a gong show getting there, but I can do this.
Yeah, there is. There's also the other stuff though.
Like what?
Menopause.
Yeah. Tell me about it.
Can we say it, right?
Absolutely. We can say it.
You think you're in this founder craziness.
Yeah.
Right. And you're like, why? I'm doing all the things and you're like struggling and everyone's giving you company advice. And really you just need to, it's your body that's freaking out. Then when you realize that and you give your body what it needs, then you're like, oh, the founder thing is not actually responsible for all of the stress in my life, right?
Right.
It's not everything.
It's not.
There's, you have kid stress and body stress and
parent stress
and parent stress. And so sometimes I think it's really just one part of our lives.
Yeah.
And that has to be kept in mind. But the menopause at the same time is a bit of a interesting.
It is.
I like to think that it offered a lot of creativity and
sure.
Yeah.
That's a good spin. But I'm actually really glad you brought that up. I mean, I'm being in the same age,
I
right?
can put in the title, like founder talks about menopause.
Why not?
Yeah, let's not do that.
But why not? I love that.
Why not?
I actually love it because I mean, as you know, on the morning show, I would talk about this stuff all the time and nobody was talking about this stuff.
Yeah.
And I'm saying this kind of like a menopause is incredibly impactful on a woman and her team and everybody around her.
And everybody around her.
And her husband, bless him. Because it impacts everything, right?
Yeah.
From the brain fog to the physical symptoms to just the inability to process some of that stress that you're talking about. Absolutely.
And even actually the husband. So, I remember the conversation I had with my husband, Peter, who was like, this is killing you. Like you've got, like, what are you doing? You have to like, where does this take place in your life? And then once we realized that it's actually like, it's this other thing that is also influencing, then it almost allowed, like it relaxed him that it wasn't something I was taking on my own.
Okay.
Right? And so it's actually really important that people understand.
Yes.
Because it's tough when you're stressed and you think you've done this to yourself.
Right.
Right?
Yes.
When you're like, what am I doing? Why am I working this hard? Whatever your job is.
Yes.
Right?
Yes.
Why am I doing this? Why am I, and you're trying to think like, for what, for how, and you're always reasoning, no, it's good, it's exciting, it's neat, I love it, the world needs it, this is going to be, a good company. But when you realize, no, this is actually something else that's working alongside of it, it de-stresses what you need the company to answer for.
Yeah. So I just need to explore that one phrase, this is killing you. Because is he talking about the company and the building of the company?
Well, it's certain moments.
I'm sure.
Yeah.
Because that's a huge statement to come from a partner, right? That's someone who's saying, I'm really worried about you.
Right. Yeah. No, there's parts where you like, you work. And I mean, it's different founders and different people that do it in a different way. But I really love it. Yeah. I really love it. And I really love the other parts of my life too, but you can get addicted. And so your body starts to like, assume the position and you like, it's like laptop size. Your body goes into laptop size.
Like it gets small and focused.
And then you're like, oh, and then you're like, okay, my mobility, like I'm not hiking the same way that I could before, right? My health. And so he's like, look, this is crazy, right? But then you realize, no, it's because my ligaments are tightening because I'm in menopause and I don't have enough estrogen. It's not.
Right. So
Right.
it's not all the company
It's not
building.
all of that,
Yeah.
right? It's like, I think his statement of it's killing you is in the same context of any husband looking at a wife going, what's happening?
What is
right now?"
happening? I don't understand.
Right.
Yeah.
But we were putting it all on
On the company.
on my, involvement in this company and this thing that I wanted to do. And so,
So
it's nice
not all
to be
that.
like, no, it's not all,
Yeah.
Yeah.
Okay. That makes sense. I like that. A little bit of perspective is
Little
helpful.
perspective. That's right.
Yeah. It's really helpful. The Founder Mindset is brought to you by ATB Financial. In the fast-paced world of tech, your banking needs evolve as quickly as your industry. Whether you're just starting out or aiming to reach new heights, ATB Financial is dedicated to supporting tech companies every step of the way. Partner with ATB Financial for a banking solution that grows with your business. Okay, so clearly there's a lot of challenges when it comes to being an entrepreneur, but you've mentioned this a couple times, how much you love this work. What do you love about it?
I love that you get to invent not just the technology, but the way that you work as a team, the way that I love all the inventing in terms of how to do things faster, more efficiently. You're inventing business models, you're inventing ways. So I love that. I love the creative process across the board. And I don't think there's another type of job where you can do that as freely. So I love that part of it. I love the fact that you see people transform, one quarter to the next, you're a new person. But your team, you give these people these 15 hats and they learn to juggle them and they evolve as these people. They start as one type of person and they end up being like, they just completely evolve who they are, which is so wonderful and cool to see. And then
so cool.
You're so nimble, to borrow a word. So Lesson and Zephyr did a deal with Align Technologies, which is the people that did Invisalign braces. Okay. And they were just kind of like, they were not a startup anymore. They were past sort of scale up, but they were still sort of had that founder early mindset, right?
Got it.
They were this big company pumping Invisalign braces around the world. And we partnered with them and we were all in awe, like, oh, they've got all this stuff. They've got a beautiful building. The project manager sitting there taking notes in the meeting and all this stuff. And yet we recognize that, oh my God, we can move so much faster than they can. We can be so much more effective, so much more efficient. And so startup companies bring something wonderful to the world, right? Whether we're the intent is to become a successful business because that's ultimately the way your technology gets out there, right? So that's a needed piece of it. But you're really creating something that no one else can do. Like it's this unique, no one else can take that type of risk, can make those types of advances. And so I just love that.
Yeah.
You
did say, though, that you evolve every quarter as a human being.
You really do.
So let's just take
it might be your baseline. Maybe my baseline is, something went, okay.
No.
It might be the baseline that, the lower you are, the more you, but you do, you evolve your way of thinking, your way of interacting, you're building processes. Like, how do we talk to each other? How do we meet? And so it's constantly evolving. You're understanding the business more, the business is growing. It's just so dynamic, right? So you look back one quarter and you're like, wow, that was the one I put. That's how, you can see your materials from a quarter ago and you're like, that's crazy. That's cool.
How much we've changed in that short amount of time.
Yeah.
Wow. That is cool.
It is cool.
It's very exciting.
Yeah.
We've got a few minutes left here, so I want to talk about impact. We think a lot about impact at Thin Air Labs, and I know you do too. So I really want to talk about, how do you think about creating impact in the world?
Things are different. You've left things differently. So Zephyr was not a commercial success. We, for many reasons, it's a whole other podcast. But we really changed the minds of how people viewed an alternative to CPAP therapy. CPAP therapy this was in sleep apnea. So we just changed the mind of how the clinical community understood alternative approaches to sleep apnea therapy.
Which is amazing.
And you could see it, right? And you're like, and then the world is different now. I see the technologies coming out and I think, the world is different because we showed that you could do this. You could create these bars. And so that's wonderful to me.
Yeah.
But Nimble's a special one because Nimble is a success impact-wise already because we have countless researchers and companies around the world that are looking at their products differently, asking different types of questions, expecting more valid answers to their products, everything from protein shakes to drugs to, Parkinson's medication. And so it's shifted, it's changed. And so that's huge.
That's massive.
Yeah, it's massive. The world, and I don't mean you, me, and my mother, although my mother does think differently. But I mean, like the people that are the ones creating these solutions in GI health across clinical, consumer, the entire spectrum, they think differently about what level of knowledge is expected from them. And they know that there's a bar that's shifted, and that's massive.
That's massive.
Yeah.
I do want to take a moment to reflect on that even further. If you take it even farther down the line, you've got the capsule and it's informing these research studies that you're talking about. But then, okay, let's take Parkinson's, for example. If that means there's a new therapy for people suffering with Parkinson's disease, that impact is massive.
Yeah. Or better yet, if the existing therapies can be applied with more precision.
Right.
Because then it's a tomorrow solution. Like you don't have to, it's not like you have to develop a new drug. It's just like, if you could understand what, in this case, levodopa is doing and how it should be tuned for you as an individual because of your microbial content, like that's massive. And that's just like, there's not a lot of steps between there and now, right? So if you could just, it's not necessarily always about new or better. It's just like, let's do what we have and understand what we have, right? Yeah. If you're taking GLP-1, let's understand what that means to your body, right? And before we just, or if you're, having a protein shake, how are you digesting those proteins, or what's happening in your lipids, and what's just, it's actually just informing actual decisions we make today.
Wow.
Yeah.
Because that really is the future of medicine, isn't it? Really, it's about being more precise. It's precision healthcare.
Yeah. Yeah. It's not treating everything.
Yeah.
It's not treating everybody the same. In GI health, it's not treating the GI tract like a tube.
Right.
Right. And measuring the poop on the end.
Yeah.
It's not a tube.
Yeah.
Right. It's a finely tuned instrument. It's got things going on.
Yeah.
And we can't just, it's about getting the right information out. Wonderful to do podcasts, to get a chance to think about. I mean, really, I feel about, these bills have to get paid, and right. It's like the other 14 hats we don't get to sit back but it does feel good. And it's motivating. It's in those times where things are sticky that you're like, okay, I don't know how you would be an entrepreneur without impact.
Yeah, absolutely.
Right? Because you have to build a business, and the business you want to be profitable, and everybody wants the exit for sure. But that doesn't the road cannot be built on the desire for an exit.
Right.
Right? It's too long.
It's too long. It's
too
hard.
Crazy. Yeah. And too hard. And so if you don't have impact to guide you, I don't know what that would feel horrible. Like, it's very helpful. On Tuesday morning at 10 o'clock, you're like, okay, this is good. This is a good thing.
Right.
Yeah.
Awesome. We want to go to our last two questions. So you're the co-founder of Nimble. You're writing the story for the company. How do you hope it goes?
I hope we replace GI health with, I want to say it's something more accessible, but how often do you think about your GI health?
Well,
probably a lot.
I do. Often.
The right answer is a lot.
And that's exactly what I do.
Even whether it's like, oh my God, I'm pooping like a machine today.
Well, I was just talking about the water, and I was, all the time.
All thinking about our GI health, but we don't think, it doesn't feel very connected to us. It's this right? We don't feel like our blood, right?
Yeah.
Like we're it's like this hidden thing that just sort of, we think about it a lot, but we don't really associate. We don't even look at our poop.
Right.
Right?
Right.
Nobody wants to look at their poop.
Right.
The Japanese look at their poop, and they're better for it. But
interesting.
So I hope that Nimble changes the language around how informative the GI tract is, so that we start to think of it like a blood sample.
Oh.
Like, of course it holds the information to my health. Wow. Right? Whereas you think of your blood, you look at your blood and you think that has information in it.
Absolutely.
Right?
Whenever you're unwell, you think, I got to go get some blood work done.
And you think, gross, I don't want to be bleeding everywhere, right?
Of course.
And that's fair, but we think of it as a source of information.
Right.
And it's valued. It's like a valued part of our body, right? You're giving it to somebody.
Yes.
And it's treated that way. And I think the GI tract, our intestinal fluid and our poop need to be treated in the same thing as blood.
Wow. That's really cool. All right. And then you are a founder. How do you hope your own personal story goes?
No one ever asks you that.
I know. That's why I like to.
I mean, I'd love a successful exit.
Right?
Let's be clear.
Be very clear about that.
Let's be very clear. My family would love a successful exit to balance what it's taken from the journey so far, for sure. I hope that Nimble ends at a point where I have lots left to give, because I'm always still in the, my husband was like, we should talk about retirement. I'm like, retirement? What are you on? And we've already revealed the menopause thing. So obviously I'm, at the age where retirement's a reasonable conversation to have. But I was like, I'm in the 101 course of this. Yeah. I hope Nimble exits and the technology lives on and the answers are there for others to partake in and build off of. And I hope that I'm left with that I can take all this and do something else.
So you're not stopping here?
Yeah, I may have to do it from like a she shed in southern Alberta while my husband's like chopping wood in the mountains. We may need like internet to be better so I can just sit in a shed.
Sit in a shed. Life goals right there.
That's right.
Sabina, thank you so much for this conversation.
Thanks, Leah. It was awesome.
If you're building a tech company in Canada, you've probably heard of Artemis. They're the recruiters founders trust to find the leaders and key teammates who'll shape the future of their business. I know them personally. They're thoughtful, genuinely caring, and deeply connected in tech. The Artemis Canada team treats every search like the future depends on it, because it does. Life sciences, aerospace, agribusiness, tech. The Opportunity Calgary Investment Fund is fueling Calgary's future through smart investment in innovative sectors and world-class talent. It's how we grow a resilient, diversified economy. Explore more at opportunitycalgary.com. API is helping innovators accelerate from idea to impact. Whether it's pharmaceuticals, medical devices and diagnostics, health technologies, or natural health products, API supports the full journey, from early research to clinical and commercial manufacturing. API bridges the gap between academia and industry right here in Canada.